You're listening to episode 77, How Can Music Therapy Help My Child? Hello, my friends. I'm so happy you're here today. I am Katie Taylor, certified child life specialist and host of the Child Life On Call podcast. This is an episode that's a 12-minute talk, which means we are quickly going to ask one of the many questions that we get in the field of child life in an attempt to give parents and caregivers really tangible tips and advice to help them build better relationships and help their kiddos cope with hard things or difficult topics. So, this is a nice little quick episode, and I have the honor of interviewing a pediatric music therapist named Christine. She works at the Cleveland Clinic, and we are going to tackle the question, how can music therapy help my child? Hey guys, did you know Child Life On Call is more than just a podcast? We have free resources for parents, kids, and professionals. And by the way, a new app coming out in 2022. We will be partnering with facilities to empower and educate kids, parents, and the care team, and we want you to be a part of it. Sign up to have the facility you visit or work for be one of the first to have access at childlifeoncall.com.
So my name is Christine Bomberger. I am a board-certified music therapist. I work at Cleveland Clinic Children's here in Cleveland, Ohio. I am originally from the Northern Virginia, D.C. area. I went to school at Shenandoah Conservatory and got my undergraduate degree in music therapy, and then came to Cleveland for my internship and have been in Cleveland ever since.
That's amazing. And so Cleveland Clinic serves a lot of different kiddos and populations. It's a pretty esteemed place to work.
Absolutely, absolutely. And I'm really grateful, and it's really wonderful how much they embrace treating the entire person, and so including music therapy as an important part of patients' treatments to, treat the mind, body, and spirit.
Oh, absolutely. And it sounds like you have had music in your life for your entire life, so it must have done something for you to kind of bring it into your profession as well.
Oh, absolutely. I really just stumbled upon music therapy as a career, and I feel really lucky that the school that I attended had a music therapy program.
Absolutely. So this is a quick 12-minute talk for parents, and I thought you could help us answer the question, how can music therapy help my child? And we can look at it in a few different ways. One is, when they're in the hospital setting and going through maybe a crisis or trauma or something. And then we can also talk about just in general how music can help children. So can you give us your expert opinion about how the ins and outs of music therapy and why it works and why it's important?
Absolutely. I'd probably like to start off with just giving kind of the formal definition of music therapy in case your listeners aren't familiar with that. And then I can kind of expand more upon some of those points.
Perfect.
So music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who's completed an approved music therapy program. Music therapy interventions address a variety of healthcare and educational goals. It can promote wellness, manage stress, alleviate pain, help children express feelings, enhance memory, improve communication, promote physical rehabilitation, and so much more.
Man, that is so amazing, especially the memory one. That one speaks to me because we all have those songs, that we're like, I remember where I was, what I was wearing, who I was with when I heard this song. And so I can imagine when a child is going through something stressful and they have a pleasant, melody or something that's happening, a pleasant interaction with music, that they can remember that instead of the pain.
Oh, absolutely. Absolutely.
Wow. So talk to us about your day-to-day and how you see music therapy actually help children cope in the hospital or outside of the hospital?
Sure, absolutely. So in my setting, which is an inpatient medical facility, I receive referrals from whether it be doctors, whether it be nurses, physical or occupational therapies. I have patients and families request music therapy sessions. It kind of depends on what's going on with the child. So somebody might refer a patient to music therapy kind of for those reasons that I said before. Maybe they're having a lot of pain. Maybe this is their first time in the hospital and they really are having difficulty coping with their hospitalization. Maybe they have just suffered a stroke and are working on building those communication skills again. So I will be consulted for, one of those reasons or many other reasons. And so I go and I visit the child, introduce myself, and kind of talk about a little bit about what music therapy is and, how I use it within this setting. And then, like I said before, I use those music interventions to accomplish those goals. So based on what the child is going through, I will use their preferred music that they love, music that they're familiar with, to help accomplish those goals. Now, music therapy might look a little bit different in other settings, whether it be in a school setting or in a private practice setting. Those settings look a little bit different than what I do day to day.
Gotcha, but they're still available. And how would parents know to ask for music therapy? Or, are you assigned to everyone? Or if they are going through a crisis, how do they get in touch with someone like you?
So in the hospital, they can ask, if their hospital has music therapy, they can most likely ask any provider to place a referral. I do not get consulted for everybody, but I do get consulted for new diagnoses of cancer or blood disorder. I wish I got consulted for everybody, but there's just not enough of me to go around.
Totally. We need to clone you.
Yeah, agreed. But outside of the hospital setting, there might be a variety of music therapy contacts in your community or within your school systems. Actually, one of the resources and a big resource that I would want to share would be musictherapy.org, which is the American Music Therapy Association. And on that website, you can find a music therapist in your area.
Oh, amazing.
And I would say that would be the easiest place to start.
I think one of the best ways to really explain what music therapy is and the impact it can have is through stories, and I've had the honor of getting to watch music therapists literally change a room from really somber to really joyful, or, just to have, one of the things I think is great is you guys can be there for procedures too if a child asks for it. So do you have any stories about an interaction with a child or family that you can share that really helps, describe the impact that music therapy can have?
Especially in a hospital setting or in a healthcare setting, there is a huge loss of control, and it can be really, really frightening on a lot of other levels. So using music, something that is familiar, something that is normal, something that is safe and enjoyable to them, using music and combined with trying to give these kids as much control as possible, like you said, can totally just change your room, can totally just change a person's thinking and a person's coping. For example, just thinking in terms of, like you said, procedural support, I will never forget doing a dressing change for, after they had a surgery, they had a dressing over their incision, and dressing changes were really hard for this patient. And, they were younger. And so, of course, one of their favorite songs was Baby Shark. So we got everyone that was doing the dressing change. We all got together. We sang Baby Shark to start. And then what we did was we changed the words to Baby Shark to the different stages of the dressing change. So this gave the child the opportunity to spray, or to sing and to know what was happening and to put it in a different context. And, I'm sure you're familiar with the melody, Baby Shark, do, 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 do. So instead, it became, they have the adhesive remover spray. So spray the spray, do, 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 do. It is cold, do, 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 do. So just acknowledging what's going on and just making it safer, making it more normal as it's not enjoyable, but trying to make it as enjoyable as possible. And just giving that child that control and adding just that extra layer of familiarity and fun.
Oh, yeah. Well, it's like you took something so scary and you took the scary out of it.
Absolutely. Absolutely. And this child did so great. And, then, when they did future dressing changes, I wasn't able to be there for the next one, but they were able to implement, the staff was able to implement, staff and family were able to do that same thing. And that just kind of became the norm for their dressing changes.
Oh my gosh, that is so cool. I love that. And I have kind of a question for you, but it's hard to get an actual music therapist. But I think parents exposing their child to music can still have positive associations. So you see these like little toddler mommy and me or daddy and me groups that are based in music. Do you recommend those as, part of a child's growing up?
Oh, absolutely. I think those groups and, music with your children is so important. It not only, helps you bond and, helps kids grow, but music is very, multisensory. When they're playing instruments, you're working on gross and fine motor, you're working on expressing yourself, on just so many different levels of growth and development.
It seems like the benefits reach way further than we could even imagine. And like the best part about it is it's music. It's not something hard that you have to do. You could either listen or you could participate, but the impact it has is so much greater than the actual effort it takes to do it.
Absolutely. And that's another thing that I find just so rewarding in my work, especially here at the Cleveland Clinic. We have patients that come from all over the world. So being able to connect with patients who don't speak English, who don't speak a language that I'm familiar with, but still being able to help them and to connect through music is just really, truly amazing.
Thank you so much, Christine, for being here and for all of you joining us for a 12-minute talk, and I will see you next week. Thank you for listening to the Child Life On Call podcast. I'm your host, Katie Taylor, and you can follow us at Child Life On Call on Facebook, Twitter, and Instagram. Please rate and review to make it easier for other families to find us. We have cute merch available at www.bonfire.com/store/Child Life On Call, and you can listen to more episodes and find resources at childlifepodcast.com.